Hello viewers, welcome to HCC Coding channel. Previously, we have covered in a previous video about the introduction of a medical coding. What is medical coding, types of medical coding, who are eligible, opportunities, what opportunities we will be having in a medical coding, and what are the available certifications that can be taken in a medical coding. Everything we have covered. Today, we will see what is a medical record. What is a medical record? We'll see that. And how many types of medical record we will be having, and what are the formats in a medical record, and about signatures we will learn. Okay. First thing, we'll go what is medical record. What is medical record? A medical record is a detailed and organized document that contains information about a patient health history, medical treatments, and interactions with healthcare providers. I can tell you very simply, it is just as a prescription in our India. Usually what our provider will be doing, provider always, whenever I am using a word provider, you can consider it as a doctor. Okay, what a provider will be doing if we are going to a hospital, he will write what are the signs and symptoms we are having and what condition he will evaluate what is the condition we are having, and he will finalize the condition and he will write the respective treatments regarding that. That might be the medications or that might be anything that will be documented in a prescription. It is equal to medical record. And medical record also, whatever the conditions the patient is having, what type of treatments they are going to give for a patient, or what type of treatments they have documented for a patient, what medications they are using, everything there will be that will be mentioned by a provider. It is simply, we will be calling it as a medical record. Now, usually what a medical record will be including? First thing, it includes, usually if you are going to a hospital, first thing what they will write, or they will ask your name, they will ask your age, gender, and your contact number, or if not, address also they will be asking. Agree with my point? The same, a medical record starts with the personal information of a patient. Personal information, or we can call it as patient demographics. What it includes, patient demographics or personal information, what it includes means it includes patient name, address, age, gender, and contact information, and so information will be documented in the medical record. This is the first information they will be documenting in the medical record. Next, they'll be entering the date. Yes, of course, if you are going to any hospital, if they are writing something in your prescription, for sure they'll be writing a date. So we will be calling it as a date of service. In India, how we will be entering a date? First, we'll be entering a day first, then after month, then after the year. But according to US format, we will enter month first, then after day, then after the year. On what day provider treated the patient, or on what day the patient visited to the hospital, that particular date will be entered. First will be the patient information like personal information or patient demographics. Then they will enter the date of service. Date of service, or you can call it as a date of visit, on which day the patient visited to the hospital, or on which day the provider or a doctor treated the patient. That date of service will be entered, and particularly in a medical record, the date standard in US standard date format is first they will be entering the month, then after the day, then after the year. You can see this as an example, October 31st, 2024, or they will be entering it as a 10/31/2024. And along with this, what we'll be having? First, we have seen there will be a personal information of a patient, then after date of service. Then after, they will be documenting conditions of a patient. That might be the past conditions, or that might be the current signs and symptoms, or previous surgeries, previous allergies, previous conditions, or family. What a mother, what his mother or what his father or what his siblings is having a conditions, everything that will be documented in your medical record. Along with that, what medications the patient is using, that might be currently he is using or previously he have used, or he whatever the medications he have been used, everything will be mentioned in the medical record. Along with that, immunizations, it is nothing but a type of a vaccines. What vaccines he or she have took previously, that also they'll be documenting here. Laboratory or diagnostic results. If the patient underwent any lab reports, that lab reports also will be attached or will be entered in a medical record. That might be blood tests, that might be scans, x-rays or MRIs, biopsies or any other diagnostic procedures. Along with that, what treatment they are going to document, what treatment they are going to mention for a patient, or what they are planning to give, everything will be documented in a medical record. These are the points we will be having in our medical record. And are they documenting it without any sequence or without any serial? No, they will be documenting with a serial. And for that, before going to that, we will see how many types of medical record or what are the types of medical record we are having, we'll see. Okay. We will be having two types of medical records. One it is electronic medical record and one more it is a handwritten medical record. Coming to electronic medical record. Electronic medical record, it is nothing but a digital version of patient records. Like where instead of writing in a prescription, they will be digitally entering in a system. The example you can see here, it is nothing but all this information of a patient will be documented in a digital version. This we will be calling it as a electronic medical record. And we'll be having a handwritten medical record. Handwritten medical record, usually they'll be writing as a traditional paper-based medical record. However, in India, they'll be using a prescription or using a paper documentation to write something. That we'll be calling it as a handwritten medical record. This is an example for an handwritten medical record, and it will be used in, usually this handwritten medical records is used in some small healthcare settings or some smaller clinics or the remote areas or facilities where the facilities were not available. There they are still following the handwritten medical record. When compared to electronic medical record and handwritten medical record, electronic medical records will be having more when compared to handwritten medical records. These are the types of medical records we are having. Now, if they want to document any information, how they will be documenting? They'll be using a format for that. What type of formats they'll be using? They'll be using cheddar and SOAP formats, which will be widely used in our healthcare industry. Okay. Cheddar and SOAP format, we'll see. What is this cheddar format? What is the SOAP format? We'll see. Cheddar format, we'll see the first thing, we'll see the abbreviation of cheddar. C means chief complaint, H it is nothing but history, E it is nothing but examination, D it is nothing but details of problems and complaints. Again D, drugs and dosages, assessment, written visit or follow-up. First we'll see what is mean by chief complaint. Chief complaint, it is nothing but reason for visit to the hospital. Why the patient visited to the hospital? Simply they'll be going for an hospital, no, right? There will be particular reason to visit the hospital. So what is the reason for visiting the hospital? That will be documenting under a header called chief complaint. Then after we will be having a header called history. In history, they'll be documenting a detailed information of a current illness. What signs and symptoms the patient is suffering, what past conditions the patient is having, what the previous surgeries or previous conditions, previous medications, everything that will be documenting detailedly in a history header. Then after we will be having a header called examination. Examination, I can tell you, it is simply physically examining the patient. Physically examining a patient means, I'll take a very simple example. If the patient went to an hospital, or for example, if we are going to an hospital with a throat infection, what usually a provider or a doctor will be doing? He'll ask us to open our mouth, and he'll be keeping a torch in our mouth, and he'll be observing what are the infections, or what the patient is actually suffering from. So the same thing, how he's doing, he's physically examining the patient and he'll be documenting the things. That all physically examining the patients, that comes under a header called examination. Under examination header, what a provider is physically examining the patient, everything will be documented under a header called examination. Next, details of problems and complaints. What problems the patient is having? Problems, it is nothing but past conditions. What past conditions the patient is having, what previously the patient underwent the surgeries, what family history the patient is having, means what the mother or father or siblings is having the conditions. Everything will be documented under details of problems and complaints. Next, we are having drugs and dosages. Drugs and dosages, it is nothing but what medications the patient is using. That might be currently used medications or previously used medications or allergies. Everything will be documented in a medical record. And assessment. So till now we have seen what is the reason for visit, where they'll be entering the reason for visit, or what are the current illness of a patient, where they'll be entering that, and what are the diagnostic tools a patient is having, what is a physical examination. By doing all these, they will finalize one condition. Okay, for example, if patient came to the hospital with a symptoms or with the signs and symptoms of fever, provider will order a blood test, and after evaluating the blood test, the provider will confirm the patient is having a typhoid fever. Here, the confirmation of a condition is typhoid fever. So the finalized conditions will be documenting under a header called assessment. Whatever it might be, what signs and symptoms the patient coming up with, and what the provider is evaluating, and what he is finalizing the condition, that will be entered in a header called assessment. Then after, we'll be having a written visit or follow-up. Yes, or we will be calling it as a referral also. If we want to, based on the condition of a patient, we will refer to any specialist, or we will ask the patient to visit the hospital again after particular days. That might be after 1 week, visit the hospital again, or after 10 days, visit the hospital again, to check whether the patient's condition is improving, or it is in stable situation, or it is in a worsening situation. Everything that also will be documented in a medical record. This is one of the format we will be having in our medical record. And the next format is, we are having SOAP format. SOAP, yes, it is nothing but subjective. O, it is nothing but objective. A, it is assessment. P, it is a plan. Now, what is mean by subjective? Subjective also, simply they will be documenting in a subjective header. They will be documenting what is the reason for visit to the hospital, and what are the signs and symptoms the patient is facing, what are the previous conditions the patient is having, and what are the current conditions the patient is suffering. Everything will be documenting in a header called subjective. And next header, we will be having objective, which is a very equal to an examination header. What we have discussed, examination means physically examining the patient. So physically examining, how they'll be physically examining the patient, and they'll be documenting the conditions in the medical record, right? The same way, under objective, they will write what conditions they have physically examined the patient, and what they have found. Everything will be documenting in an objective header. And coming to the assessment, as we have discussed, assessment, it is nothing but what is the finalized condition by seeing all the signs and symptoms, or by evaluating the patient diagnostic reports. By seeing all these, they will finalize a condition, that is nothing but assessment section. And coming to the plan, it is nothing but, for example, if the patient condition is confirmed has a typhoid fever, what medication is required for that particular patient, or what type of treatments that particular patient is required, everything will be documenting in a header called plan. It is simply, you can call it as a treatment. What treatment we are going to give for a patient, that will be documenting in under a header called plan. These are the points we will be having in our medical record. Okay, all these points, by giving particular header, by keeping subjective, objective, assessment plan, by keeping all these header, they'll be documenting each and every condition in a separate way. They will not write all together. They will write each and every specification. They will be mentioning it has a separate header, and they'll be documenting under that. And next, so usually what we have seen in a medical record, first they'll be starting with the personal information or patient demographics of a patient. Then after, date of service they'll be documenting, I have told. Then after, what is the reason for visit, or what is the evaluation, what they are evaluating the patient, what are the diagnostic reports they are ordering, or lab reports they are ordering, and what they are finalizing the condition, and what treatments they are going to give. Everything will be documented in a medical record. After documenting all this, there must be a signature in the medical record. Based on the signature, we will confirm it is an evidence that the patient is or the provider is reviewed the patient. By seeing the signature in a medical record, we will confirm it is reviewed by a provider, or it is seen, or it is physically examined by a provider. By seeing the signature itself, we will confirm. So in signature also, we will be having two types of signatures. One, it is electronic signature, and one more, it is the handwritten signature. Handwritten signature, usually you are having an idea, it is nothing but scribbled signature, how we will be keeping a sign normally. The same way, we will be having a scribbled signature. I can show an example also. This is an example, scribbled signature with a hand, and along with that they have to document the credential along with the data. The mandatory things for a signature, that might be the handwritten signature, or that might be an electronic signature. The mandatory things are, if it is a handwritten signature, there must be a scribbled signature. Along with that, credential should be documented. Credential, what is mean by this credential? Means a specialist. What type of a doctor he was, whether he was a valid doctor or invalid doctor, all these they will be documenting as a credential. If a patient is reviewed by a nurse, can we consider it as a acceptable medical record? No. It should be reviewed, or it should be examined. A patient should be examined by a valid provider. If it is reviewed by any nurse, then what is the purpose of a doctor? So, how we will identify whether it is a valid provider or invalid doctor? Based on the credential. So, for a handwritten signature, there must be a scribbled signature. Along with that, credentials are mandatory. These two terms are mandatory. Provider's full name and title or credentials is required. Along with that, if they are documenting date, it is fine. And coming to electronic signatures. Electronic signatures, it is nothing but digital version of signatures, I can tell you, where it requires three important components. Authentication, we require an authentication, provider name and credential. What is that authentication? Signed by or electronically signed by. This is nothing but authentication, and provider name Jane they have mentioned, and the credential is MD. And date, it is not a mandatory thing, but if they are documenting, it is fine. So these are the three components it is required for an electronic signature. One, it is authentication. Authentication is nothing but electronically signed by or signed by. That points will be calling it as authentication. Then after a provider name, then after a credential. this comes under electronic signature. You can see the difference. In a handwritten signature, we have seen just a scribbled signature along with the credential. But coming to an electronic signatures, all these 3 points are important. Without these 3 points, we cannot consider it as a complete signature. So this is about the medical record and the components present in a medical record. More interesting videos, please like, share, subscribe to our channel, and next video will be coming with more interesting things. Thank you.